Yes, good morning. Thank you so much for following us in the previous videos. So today we shall talk about dental caries. And dental caries the same as tooth decay. Tooth decay is the common word used, but for us here in our dental lectures, we shall say this is dental caries. If you have not subscribed, please subscribe to the channel and follow us in our videos. So dental caries, or what we call tooth decay, dental caries is a disease. So there is nothing called dental carie, like some usually say. So once we say dental caries, it is one disease. There is nothing like dental carie. So dental caries or tooth decay is the disease we are going to talk about. Previously, we had talked about a tooth, and we said a tooth can be, is usually made up of enamel, dentin, and the pulp. But the enamel is 96% inorganic, meaning it is made up of the tissues that are classified or they're having a lot of inorganic content in them. So these are all going to help us in defining dental caries. So we shall say dental caries, we shall use words which are very sensitive. We are saying it is irreversible. The word irreversible means once it has started, you do not maybe swallow painkillers or get anything to reverse it. It is irreversible, progressive, obviously, microbial, caused by microorganisms, and of course disease of the classified tissues, the tissues of the teeth. And it is usually caused by demineralization. When, as we shall say, when this inorganic content is wearing away, since it has a lot of minerals, we shall call it D, meaning the removal of the minerals, demineralization of the inorganic portion of a tooth, and also the organic portion. For example, this one and this, they are made up of more of organic. So also the organic portion is also destroyed, and in the due process, we are forming a cavity. So in my definition, in whichever way you want to arrange your definition, we shall expect you to talk about it as a disease which is irreversible, of course, caused by microorganisms, and of course, calcified tissues of the teeth. It's going to cause removal of the minerals or demineralization of the inorganic content. We cannot say demineralization of the organic because there are little minerals there. Now we are saying the destruction of the organic part of a tooth, and we end up forming cavities or cavitation. That is our simple definition. You shall remember again that we are having mainly three parts of a tooth. We have the enamel, that is what is out of the body, or what is in the oral cavity seen, and what is seen, of course, you see the crown, the neck, you may not see, and the root down. I remember telling us in the previous videos that the enamel is made up of, the crown is made up of the enamel up to here. Then the root is made up of what? Cementum. From here to here, cementum. As you enter inside, you shall have the dentin. After the dentin, the what? The pulp. And in the pulp here, it's where we have blood vessels and nerves. In this red part is where I have blood vessels and nerves. In this middle part, it is the part which is called dentin. In case you have caries here, you are going to expect some sensitivity. But once we have in this inorganic part, of course there is nothing because there are no blood vessels, no nerves. We shall explain the sensitivity in the dentin as we continue, and we shall say that in the pulp we are expecting pain. But for now, we are saying whichever way, whether it is in the enamel, we can say the caries are in the enamel, so we can say dental caries in the enamel caries. Whether it is in the dentin, we shall say dental caries in the dentin, and shall say dental what? Caries. Still dental caries in the dentin. Whether it has reached the pulp, we shall also say dental caries in the pulp, and therefore can also call it what? Dental caries. I hope you shall memorize these keywords in the definition of dental caries. We shall end up forming what? Cavities. Thank you so much. When you're talking about dental caries, having talked about the very serious point about microbial, we shall not live without defining what we call dental plaque. Usually, once you do not brush your teeth, maybe 1 or 2 or 3 days, even 2 days, you shall feel by your tongue something sticky. Something sticky. You have lost your toothbrush, you have not brushed your teeth for 1 to 3 days. You shall feel something sticky. When you get your toothbrush, you clean it, it goes away. This is what we call dental plaque, and we are defining it that this is a microbial deposit or microbial colonization on your teeth or on teeth, which consists of of microbial deposits adhering, attaching firmly on the teeth. They cannot be removed by a stream of water. You cannot rinse and you remove it. But mechanical removal, maybe a toothbrush or a stick, for those people who brush using those things, mechanical removal. We shall talk about mechanical removal. Maybe of a toothbrush is able to do what? To remove it. That is plaque. We shall later say that when plaque is bathed or it is continuously bathed by saliva, because you say the saliva has minerals, once keeps on having saliva bathing it continuously, it's going to harden. And once it hardens, it forms what we call caliculatus. But for now, this microbial, because the bacteria we are talking about which is causing this, the cavities, is in the what? In the plaque. So we are saying in the plaque here, we are having bacteria in remains of food, and this is the form of what? Deposits. So that is plaque. Thank you so much. So we need to continue and we go to the classification. So in other words, we are saying in a layman's language, once you have a hole in your tooth, we shall call it tooth decay, and we are saying that is what? Dental caries. What we can now classify dental caries. Classification of dental caries can be in around 6 or more ways, but the main ones is what we are going to talk about. Among these ones, even which I have, they are those that we normally use. I'll bring it as number 5, the GV black. But there are many classifications. We are going to go through them briefly. Classification number 1 is classification of dental caries. different people classify dental caries, but we are going to see different ways how they can be classified. Classification number 1 is according to anatomical site. Remember, when we talk about the anatomical landmarks of a tooth, we said we can have, once we said when we have your tooth, we say the part of the tooth here is occlusal surface. If at all we are coming from the midline here, this one is the mesial surface. If we are on the opposite side, this is the distal surface. Towards the tongue, that is the lingual. Away from the tongue, towards the cheek, that is the buccal surface. So anatomical landmarks, if we say the occlusal surface is the surface that bites, that occludes the top part here, occlusal. And we said occlusal, it has depressions there, and these are what we call fissures. We said in our previous video that these ones here, these lines here, these are called fissures, and the depressions which are made are called pits. So we are going to see that the cavities begin from these pits. So when the cavities or caries which begin from these areas, they are called pits and fissure caries. Usually, as we said, dental caries are going to happen according to the enamel rods. So this one is going to make our clinical diagnosis very difficult, because on top it seems small, but down it is a bit triangular. That is why your patients will always tell you he has a small cavity or a small hole on your tooth, because for him or her, she feels the cavity is small, but down it is what? Big, following the anatomical way how the enamel rods are what? Are formed in the enamel or in the tooth. So it is making clinical diagnosis a bit difficult, because on top it is small, but down it is like inverted V, as I'm stating in this side or on this bone. According to an anatomical site, another one is proximal caries. We said proximal caries, this side, if at all we have two teeth, I've already said this one. If this is a tooth and this is a tooth, proximal surfaces, we say this is a surface. If this is a surface and this is a surface, this is maybe mesial if this is our midline, and this is what? Distal surface. Of course, we are going to have dental caries beginning in this area. That is why when you are doing your tooth cleaning, you need to emphasize removal of these teeth. As we shall see, removal of food in these areas may be difficult a bit by a toothbrush, but we can use flossing, as we have explained, or we are going to explain later. Yes. We have another one here called, so before we leave that, smooth surface or proximal caries, they are going to be in the proximal surface or in the area between one tooth and the other. These areas are not having fissures like up, or those areas of retention which could easily have food remains there, but the challenge is in these areas they are difficult to clean, these proximal areas between one tooth and the other. So this is what we call what? Proximal caries. So we have another one called odontoclasia or linear enamel caries. We are saying it is seen mainly in maxillary teeth, and usually once there is a metallic deficit of calcium, and thus all the lateral surfaces of teeth are what? Are destroyed. The last one, which we shall emphasize once we reach on poor oral hygiene, is what we call root caries. Root caries, once we have our tooth like this, of course, this is the enamel, this is the root, this is the root, this is the crown. So once we don't, of course the gum is around here. Once you don't brush your teeth, we said this enamel covers the crown and the cementum covers the root. The enamel is 96% inorganic and is more harder or more inorganic than the cementum, which covers the what? The root. So in case we have poor oral hygiene, people who do not brush well, we have food retained here, we shall have more progression of caries or of dental tooth decay, more rapid around the what? The root. So around this area. So this is what we call root caries. The caries near the root, and they are always found around the gum line or the cervical line, because it's where this is the gum. This is where we have the gum, and food is always retained around here. So they begin around here because of the microbial deposits of plaque around this gum line. Thank you so much. We can also now get another classification according to progression. Classification according to progression. So dental caries may progress at different rates. So this person who gave the second way of defining or of classifying dental caries, for him or her, he defined it according to the progression. We have acute. He's saying acute is rapid, is involving a number of teeth, and of course there is sensitivity. The teeth are more, they are involving a number of exposures. Because of demineralization, there are many. You can see a lot of cavities on this tooth, this tooth, this tooth, and everything is rapid, and therefore they are causing what? Sensitivity. And for the cases where we have the progression being long standing, it is taking a long time, involving few teeth, and even the exposures are smaller, the small cavities. And when there is no pain, is when we shall define that as what? As chronic caries. Then also, still on the rate of progression, there is some time when someone has, maybe in pits and fissures, around the pits and fissures. Around the pits and fissures, we can have sometimes we get cavities which begin, of course, around here, but after some time, due to change of habit, due to maybe mineralization, this progression stops. Without any conservation or without cementing a tooth, but it stops. Of course, we say it is irreversible. It is not reversing that is healing, but it stops there. Once it stops and is still in the part where it is not paining, we shall always, when you look in someone's mouth, you shall see some things black, a bit black on the fissures. These black things, we are calling them arrested caries. The caries are arrested. So this is what we call arrested caries. We say number one, we have acute, chronic, and arrested caries. They became stationary and do not show any way of what? Of progression. So that is another what? Classification according to the progression. So we have another classification according to the number of tooth involved. The number of teeth involved. The number of tooth surfaces, not tooth. Remember, we said on a tooth, we have more than one tooth surface. If this is our midline, we can have our midline. Towards the midline, we say this is the mesial surface. Away from the midline, this is the distal surface. Towards the tongue, if the tongue is this side, can call it the lingual surface. Towards the cheek, we are calling it the buccal surface. Towards where we bite from, where we grind food from, this side, we are calling it occlusal surface. If at all they are upper teeth, we said we can have what we call the palatal surface instead of the lingual surface. So all those are surfaces. So we said once we involve on one surface, maybe on a lingual surface or on an occlusal surface, this person defined it as simple. Those are simple caries. Once we have more than two surfaces involved, those are what? When we have only two surfaces involved, those are compound what? Caries. Once we have more than two surfaces involved, maybe we have occlusal, lingual, and buccal surface, then we can call them what? Complex caries. We also have another classification, number 4, according to coronation. Coronation based on coronation. Coronation, we have what we call early childhood caries. Early childhood caries, these are caries that are in children below 71 months of life. 71 months of life, that is around, can I say, between around 6 years of age. So from birth to 6 years of age, those are what? Early childhood caries. You find a child is having, usually children who have poor oral hygiene, children whose mothers have not taken care of their teeth. Maybe they have taken a lot of carcinogenic food, maybe sweets, biscuits, and sodas. Maybe even some children who have taken medication, because medication, especially syrups, have a lot of sugars in them. You find excuse me, you find maybe more than many teeth, especially maxilla, they are all affected. That one, we are calling it early childhood what? Caries. We can also have adolescent caries, also which involve what? Pulp exposures. So here we can have maybe objective question, early childhood caries. You shall remember between 0 to 71 months of life. If it is more than this, it stops from being what? Early childhood caries. The most common used classification is called the GV-Black classification. GV-Black classification is the one which is usually used, and we call Green-Verdman Black classification. He classified according to 1, 2, 3, 4, 5, 6 classifications or types in his classification. So classification number 1 is the classification according to the pits and fissures. Classification according to the pits and fissures. So I already talked about the pits and fissures on the occlusal surface of a tooth. But for him, he said that even under pits and fissures, we have the cavities on the molars. Of course, we said molars are the posterior teeth. You shall remember, molars are the posterior teeth. We talked about premolars. We said they are only found in permanent dentition. Also said they are bicuspids. We said in each quadrant of primary dentition, we have 2. Meaning we have 2, 2, 2, 2, 2, making 8 of them. Of course, in permanent dentition, because they are not in primary dentition. And we said all of the premolars have 1 root, except the first permanent, the first premolar. It means the 1-4 and 2-4, they are the ones with 2 roots. But others have what? 1 root. If you have not remembered that very well, you need to check the previous video about tooth surface, about different parts of what? Of a tooth in the previous what? Video. Each tooth. So this classification, of course, the occlusal surface is where we have pits and fissures. So we shall say on molars and premolars, we shall have, of course, on this occlusal surface is where we have cavities. Then we have what we call occlusal two thirds. We can have if we can say this is the occlusal 2/3. If we can have a cavity around there, it is not on the occlusal surface, but this can also be called what? If it is either facial or lingual surfaces, it is also called what? Class 1. We also said the anterior teeth do not have occlusal surface because the surface is dimensional, but for this they have incisor edges. So if we can have on the palatal surface or the surface towards the palate a cavity there on the palatal surface. The palatal surface is if I tell you this is our model, and the palatal surface is maybe where I am marking blue. This can also be what? Class 1 cavity. So either on the occlusal surfaces of molars and premolars. We are also saying they can be on the occlusal 2/3 of either the facial or lingual surface of the tooth. Also now we are saying under C, classification of C, still but under 1, we can have the palatal surface of maxillary what? Incisors. Thank you so much. That is classification number 1 of the GV Black. Classification number 2 is the cavities on the proximal surfaces of molars and premolars. I already talked about the proximal surface. I said the proximal surface we are meaning if this is a tooth, maybe it's a 4-6 and 4-7 proximal surfaces, we are meaning either this surface or this. These are the proximal what? Surfaces. So a class 2, we are saying these are cavities on the proximal surfaces of what? Of molars and premolars. So what we are, those are proximal surfaces. So any cavities just reaching at the proximal surface, all this around here, that is called a class 2 cavity of molars and premolars. You shall remember that for class 2, we are meaning either on the mesial or distal surface of a tooth, so long as it is what? For molars and premolars. This is likely to change once we reach on anterior teeth. Class 3. Class 3 are saying these are cavities on the proximal surfaces of anterior teeth, like we talked about here. Proximal surfaces of anterior teeth. Proximal surfaces of anterior teeth. But not involving incisor edge. What do we mean? The incisor edge is this one, which bites. So we are saying the cavities which do not involve the incisor edge. So it means that we can have caries up to here, or up to here, or even up to here. This is class 3 cavities. These are class 3 cavities. Anterior teeth, mesials are proximal surfaces, but don't involve the what? The incisor edge. Once they involve the incisor edge, they are going now to be called class 4. Cavities on incisor edge of anterior teeth. Once they involve the incisor edge, they are going to be called class 4. You shall know that for class 2, they are for posterior teeth. Class 3, we are saying they are for proximal surfaces, but for anterior teeth. Anterior teeth, we are meaning canines and what? And incisors, but not involving incisor edge. Incisor edge is this biting line here. But once we talk about cavities on the incisor edge of anterior teeth, we shall mean these ones, which are what? These are the incisor edges. It may be small. It may be small. Maybe small, but so long as it touches the biting edge or the incisor edge, we shall call that one what? Class 4. Then we have class 5. We are saying this is around the gingival third or the crown, and on either the lingual surface, because say the lingual surface is the surface towards the tongue, and the buccal surface, this is the surface towards the what? Towards the cheek. So on our teeth, the surface towards the cheek or towards when we say class 5, around the gingival third, this is around the gum. That is what? Class 5 cavity. If this is the gum area, the class 5 is around there. We are saying this is not involving the pits and what? fissures. The cavity around the neck of a tooth. Lastly, we shall have the cavities on the cusps and the cusp of posterior teeth. So cusps, when we talk about anatomical landmarks, we shall remember saying a cusp is what? Is an elevation on the occlusal what? Part of the tooth. So this is a cusp, this is a cusp, and this is a cusp. These ones are just on the what? On the tips of a tooth. We shall have the last classification according to World Health Organization or the WHO classification. This one defined or gave it in terms of D1, D2, D3, and D4. Where I said D1, remember the diagram we began with, where we are having a tooth that was the outer surface, and lastly we shall have the inside part, the pulp. So if this is our enamel, this is our dentin, and this is our pulp. So the classification of the World Health Organization is in terms of D1, D2, D3, and D4. Where D1, we are having a clinically detectable, clinically meaning you are using your eyes, you're seeing it physically. Clinically, you're detecting a cavity, but the surface is intact. Once we look into classification of caries, we shall find that there are sometimes when you look at a tooth and you see it is going to be affected, or it has already characteristics of enamel caries. Enamel caries can be seen by incipient lesion. There is nothing, because we said in the enamel we have no pain. We don't have pain in the enamel. We do not have a cavity in here, but we are having incipient lesion. We can be brown or black spot. So this is clinically detectable, but the surface is what? Intact. There's nothing you can see. Then D2, it is clinically detectable, but in the what? In the enamel. So we have enamel what? Caries. Then here we have D3. We have clinically detectable, but in the dentin. It has reached the what? The dentin. Remember, we said in the dentin, we do not have pain. We can only have sensitivity. Then, lastly here, we shall have the pulp being what? Involved. That is D4. So we define it, we give it under D1, D2, D3, D4. D1, the surface is intact. D2, it is limited to the enamel, have enamel caries. D3, the skin can be detectable in the dentin. And lastly, we have pulp involvement. Pulp involvement. We need to talk about something. So this is briefly the classification of dental caries. There is something very important we need to talk about. The cause are the factor determinants of dental caries. Factor determinants of dental caries.